All right, hello, I'm going to be talking about why our current system is working and there's no need for any change. So for those of you that don't know, our current system is commonly referred to as Obamacare. And Obamacare was implemented after the Patient Protection and the Affordable Care Act were passed in March of 2010. And the purpose of this bill was to expand Medicare and Medicaid to millions of people while regulating the insurance companies. And the plan contains thousands and thousands of provisions and rollouts of certain regulations that are set to take place over the next 10 years. So it's important to realize that we're still in the infancy stage of our current system and that it's going to take time to see the real results from it. But even so, through the 2 years or 3 years that it's been implemented, it's already had several benefits. Now, to touch on some of the key points that my opponents have brought up about the current system failing to cover, failing to insure people, and it even fails to cover people who are insured, and how the current system is only for profit and has its own flaws and everything like that, and that their proposed plan will save money. First off, I want to start by addressing their claim of how our current system fails to cover those who are insured and uninsured. And according to ObamacareFacts.com, 54 million Americans with private health insurance now have access to preventative care services with no cost sharing due to minimum standards of Obamacare, and Obamacare reforms and expands Medicaid to an estimated 15 million of our nation's poorest. So through the time that it's been implemented right now, millions of people have more access to healthcare, more access to those necessary procedures that they weren't previously allowed. And in addition, Obamacare gives 47 million women access to preventive healthcare services and makes it illegal to charge women different rates than men. Obamacare gives seniors access to cheaper drugs, free preventative care, reforms Medicare advantages, and closes the Medicare Part D donut hole. Also, the AARP has agreed that costs won't go up due to the revisions of the Obamacare Act. And also, in addition to that, according to Craig Harrington, who wrote, according to the CBO, a nonpartisan body organized to provide cost estimates on pending legislation, the bill will cover 32 million of our nation's 47 million uninsured, bringing the national total to nearly 95% coverage. It will reduce the deficit by 138 million over the first 10 years and by 1.2 trillion over 20 years. So by saying that people are uninsured is untrue. Clearly, the current system is going to cover and has already started to cover and expand coverage for millions and millions of people. And then they also claim that people die each year without insurance. And people are going to die in healthcare systems. That's one of the inefficiencies of any healthcare system, and that would occur regardless of single payer or the current system. Whether it be through not having insurance or the massive waiting lists that occur from implementing a single payer health system, which we'll get into in the disadvantage arguments. Also, according to David Hochberg from freemarket.com, the government in a single payer health system will pay for everyone's health care. It limits access to health care in a single payer system because people overuse it, causing high waiting lists. And governments ration care or waiting lists for surgery and diagnostic procedures by canceling surgery. So if you're not dying from having insurance, you're dying from waiting on the wait list. And the single-payer healthcare system creates those waiting lists, which are causing deaths, which, again, we will explain further later. The Affirmative also talked about a documentary by Michael Moore and the tragic story he shared about the woman whose baby died because they couldn't get her to the right hospital. Well, first off, that documentary was made in 2007, which is 3 years prior to when our current system was even implemented. And although that story is tragic, the purpose of our new system is to regulate those incidences and has already started to address those causes that caused this tragic story to happen. So that was a problem with the old healthcare system, but has now been reformed to our current system now, which is already being addressed. Those problems are already being addressed. As for the current system being implemented for lucrative reasons and having its own flaws, that's not necessarily in argument at this point. The old system before Obamacare was implemented did have flaws. That's the whole purpose of Obamacare. Like I said, it regulates insurance companies. So this whole talk about HMOs and healthcare systems only caring about the profit and stuff like that, that's exactly what Obamacare sets out to regulate. And according to Marilyn Werber of the National Journal, provisions in the House and Senate passed health reform bills that would require insurance to spend 80 to 85% of premiums on medical claims. So it's forcing medical insurance companies to use 85% of their profit or their income from health insurance to go back into paying for the claims and the health insurance for the people that they covered. And in addition to the amount of people that are going to extend their coverage, a lot of what money they would be profiting off of is going to be put back into paying for the medical procedures that these people need. Lastly, they talked about how their system is going to save money and increase coverage, and similar to Canada and other countries that have single payer. Real quickly, I just want to address that Bonnie Kravasi of the Huffington Post stated that more than 5.2 million seniors and people with disabilities on Medicare have saved a total of $3.7 billion on prescription drugs since parts of the Affordable Health Care took effect in 2010. So we're already starting to save the consumers money through our current system. And in addition, the government gave $250 checks to 3.8 million people to hit the donut hole in 2010, and gave Medicare recipients another 2.8 million in discounts and the first 5 months of 2012. And this is on track to cover that Medicare donut hole that has been causing so many problems. So basically when they say that single-payer healthcare will save money, our current system has already started to take effect in saving consumers money.